Senator Mallory Johnson.
Okay, we're live.
Okay, thank you. It is 7 a.m. and we welcome everybody to our March 4th meeting of the Eastern Idaho Public Health Board. We are glad for all of those who are able to be in our meeting, whether it be streaming on our YouTube channel or at the meeting location. We also welcome all those who are participating in our meeting today, including hospital administrators, our division directors, our chief financial officer, as well as others. And of course, we appreciate our director, Jerry Rackow, and our epidemiologist, Mr. James Corbett. We'll go ahead and call the meeting to order, and we'll begin with a roll call of all of our board members. We'll start with our board physician, Dr. Nelson.
Barbara Nelson, present.
And Teton County.
Bill Lake, present.
Madison County.
Brett Mendenhall, present.
Fremont County.
Blair Dance, present.
Jefferson County.
Shane Young, present.
Clark County. Commissioner Shenton, are you hearing us in Clark County? We may have some audio difficulty. I noticed Commissioner Shenton on the line, so we'll hope that he joins in with us. Lemhi County. We may be missing Lemhi County and Custer County. Commissioner Butts.
Commissioner Butts, present.
Okay, thank you. So let me know, Jerry, if we get those other two commissioners on.
Okay.
We'll go ahead and continue then. I do want.
Mr. Chairman, may I?
Yeah, Commissioner Mendenhall.
Is it in order to, I would like to make a motion to amend the agenda for today in item 7 on the agenda to include Madison County in that discussion.
Okay. So there's a motion to amend the agenda, include Madison County in the discussion that was just inadvertently admitted and had not realized that it needed to be a part of that beforehand. Is there a second to that motion?
This is Commissioner Dance, and I would second that motion.
Okay, we have a motion and a second to amend the agenda to include Madison County, which would include any modifications for any health, any order within our health district. All those in favor say aye.
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 Mr. Chair, Bill Lake, I'd like to make a motion to amend the motion.
Go ahead.
I'd like to see item 7 moved up before we have discussion on changing the plan. I think the fact that Madison and Teton County are under current orders with the existing plan, we should have that discussion before we go change the plan.
Okay. Let's see. So you're not changing the wording. You're not adding anything to the agenda. You're just asking for a revision in order.
Yes.
Okay. We can go ahead and revise the order of the agenda without a motion, without board action. And so we'll go ahead and first vote on the motion on the floor, which is to amend the agenda to add an item to number 7, which would be Madison County. All in favor say aye.
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 Is there anyone opposed? Okay, now, Bill, I do not have a problem if you want to move the order of the agenda. So we'll put item 7 preceding item number 6. And without objection, I would also like to move item number 11 to follow item number 4. So I'd like to have a report from our division directors during the middle of the meeting rather than at the end. So does that satisfy your need, Bill?
Mr. Chair, I want it moved before item 5, not item 6.
Oh, I'm sorry.
Yeah.
So before item 5, yeah.
Yes.
All right, thank you. So we have that amendment to our agenda to item 7, and then we've also rearranged the order a little bit, which is fine. So we'll go ahead and proceed through the agenda as now noted. We'll move on to item number 2, which is approval of our February 4th meeting minutes. They were sent out to all board members and are on our website. Is there any additions that are needed or changes to those? If not, I'd entertain a motion to approve.
Commissioner Young moves to approve the meeting minutes from February 4th, 2021.
Barbara Nelson, second.
All right, there's a motion to approve the minutes and a second. All in favor, say aye.
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 Anyone opposed? All right, thank you. We'll go ahead and move next to a report from our regional healthcare providers. I did see, we'll go ahead and start with Eastern Idaho Regional Medical Center. Mr. Hoffenberg.
Yes, good morning. Can you hear me?
Good morning, David. Thank you for being here.
Thank you for having me. So as you all know, you probably have started to see some of the numbers from our region, but we are starting to see an uptick in COVID cases back at the hospital. Where we were at our peak, we were at 56 hospital admissions at ERMAC. And I don't know the exact number that was across the street, but at ERMAC, we were at 56 in mid-December going into the holiday. And as of early this week, we got up to 20 again after being down a few weeks ago at as low as 6. So we've seen a bit of a spike back up. We are doing okay in terms of our staffing. We are not as bad of a situation as we were during the holidays. We've done a lot of hiring, and that's really helped our situation. So our overall census in the ICU of our 29 beds at the moment, we've got 21 filled. But really where a lot of these patients are sitting is in our PCU on our COVID unit on our 4th floor. So not ICU level, which is positive. So in terms of where these patients are, of the ones we have in-house, only 4 of them are ICU level. So vast majority of them are on our med surg floor. Just where that challenges us is then having beds available for downgrading our ICU patients out of that area and making sure that we have med surg beds available. So the acuity has certainly shifted away from much sicker patients that we were seeing late in the year, where a vast majority at that point, over half of our ICU census was COVID, where now that's not the case. So that's one change to what we're seeing, but still we are anticipating with, masking lightening up that these numbers continue to stay higher than we had seen coming out of the holidays. Now, one thing that we have seen, and this is a trend not just in Eastern Idaho, but across the country, is we've seen a far, far lighter flu season than we anticipated or we have ever in the past. I think last year, right around this time, when the board started inviting the hospital leaders to the facility, we were seeing unprecedented respiratory disease in our ERs, and that's not COVID related. We were tracking all respiratory as a percentage of our overall ER visits, and we were as high as 40% at that point in April and March of last year. We're now, I think, because we did have masking in place, we have not seen flu and RSV hit like we typically do. And so our PIC use and our respiratory areas have not seen high census at the moment. But, again, we're still kind of early on, and we might see that shift away since we have seen masking lighten. So we're kind of in that we're ready to really ramp up if we need to, and we're anticipating and planning for that to occur. Outside of that, we are still seeing, as compared to last year, just lighter volumes in some areas, and heavier volumes in our medical areas. But I think folks are still cautious about coming and getting care if they absolutely don't need to. And so we're ready to go if things continue to get worse.
Okay, thank you very much for that report. I noticed you're still showing, and actually I don't know which hospital it's in, but I noticed we have a 9 or 10 out of district patients. Or where are they coming from?
Commissioner Reed, I apologize. I don't have my list. I typically get a list of their home zip code / counties. I will get that to you. Although, just looking at my transfer report, I get texts every time a transfer comes in. I know in the last week we've gotten COVID positive patients from Western Wyoming, from the Teton Valley. I believe we even got one from Steele and Lost Rivers area in Arco. So it's probably us that has the vast majority of the ones coming from throughout the region. That's very typical to our patient population anyway.
Okay, thank you. We'll go ahead and go to Idaho Falls Community Hospital, Mr. Jackman.
Good morning. Thank you.
Good morning.
I would echo what David said. We've gone from a high of 36, I believe, during our spike shortly after Thanksgiving. We made it down to 1 patient on our med-surg floor at the beginning of last week. But starting at the end of last week, we started to see an uptick. We currently are sitting at 14 on our medical floor and 1 in the ICU. It has been a while since we've had any in the ICU on ventilators. So we have seen a decrease in the severity of the illness. The unfortunate thing that we've seen is, of those 15 patients, 2 of them have been vaccinated with both shots. I think the time frame between the shots was about between 3 and 4 weeks. So after they had completed their vaccinations, they did contract the coronavirus. But as I said, we are seeing even though we're seeing a trend up in the numbers, we are seeing a trend down in the acuity of the illness. I believe all of ours are from within the district, so somewhat local. And we're doing well with our staffing and our supplies. We did take advantage of some help through the Idaho Hospital Association and brought in some travelers during the end of last year and the beginning of this year, and have also been hiring up in our numbers. So we're currently sitting near capacity for our staffing because the travelers are gone, but we are going through a hiring spurt right now. So I think we'll be able to stay ahead of the numbers.
Okay, very good. Thank you. We'll go ahead and go to Madison Memorial, Dr. Gonzalez.
Good morning.
Good morning.
As far as Madison, and honestly, I checked with a couple of the other hospitals in the area. I think we've all seen the same timing of the uptick of patients, which was interesting. our numbers are smaller at Madison. We went from 0 to 6, but it's all relative as far as our size and our hospitals. The age of the patient was a little bit younger, the severity a little bit less severe. I think our staffing has been good. I'm trying to think if there was any, I know what I wanted to add. Again, probably the same thing in the region, and we can probably coordinate this if it would be helpful for the board in your agenda. We could probably coordinate a similar report by the CEOs, because I think we're seeing the same trends now. But I would add one thing on the respiratory viruses that David was talking about. I had provided a report to our commissioners. We had pulled that data, and honestly, we hadn't seen any inpatient influenza or RSV. And I think that data went through the end of February. And for RSV, for our kids, we tend to, at least 50% of those kids that we see hospitalized at Madison, we end up transferring out. And so it's been impressive on, the measures, whatever combination of measures, what they have done to the respiratory diseases in general. And so, and again, I kind of, knew these two guys were speaking, so I spoke with Keith and Jeannie and Still. And so I think we're all seeing some similar trends in the region. And so we'll try to coordinate some conversations if that would be helpful to the board moving forward.
Okay, thank you. Well, it's been really evident through the other respiratory diseases how much the mitigation factors, including the face coverings and everything, help slow spread of viruses. Are there questions from board members or any of the hospital administrators on? Okay, I'm not seeing any questions. Thank you. You've been with us throughout this entire year, and we appreciate the reports each and every time. As I've said before, this has been the purpose of our work, is to help ensure these hospitals remain healthy. And so we appreciate everything that you all have done, and appreciate you being on the meeting. I want to make note that we have been joined by Commissioner Madsen, so we welcome you. And of course, we have Commissioner Shenton on the line as well. So we have a full board with us today. So we'll go ahead and move to item number 4, situational report. And Director Rakow, I'll let you lead the discussion as you may.
All right. Thank you, Mr. Chairman. We're just going to bring up our dashboard here and walk through some of the data. I'm going to turn to James Corbett to lead us through this part of the discussion.
So it's going to be similar as we go through these data that as the hospitals are reporting. As we know, hospitalizations occur soon after case increases. Anywhere from a week to 2 weeks, we start seeing those hospitalizations increase as cases have increased. You can see just a snapshot I'm going to go through quickly here. Yesterday's cases being 93. That's up from lows in the last part of January and first part of February. Active cases increasing to 474. I believe we hit a low of 300 at one point, or maybe slightly even under that. Hospitalized residents at 26, standing there currently. We can just go to that next screen even. So, and we'll come back to this page here in a moment. This is just showing Bonneville County, but it actually is a fairly good indicator of our overall district. And I'll just kind of show this line here. We did see that swoon of cases, I'll call it, right there towards the last part of January and early part of February. And since about the middle of February, we're seeing an increase to the point where Bonneville's active rate, again, right here at the bottom, is 24.1. You can see that increase in cases is happening quite drastically. We're watching it very closely. Yeah, we can choose another county. Let's go to maybe Teton County. Teton County is still experiencing, you can see that same kind of swoon, just on a maybe smaller scale. They did have a fairly large day at the beginning of this week that had multiple cases, so their active cases has gone up. They're sitting at 15.6 currently, with fewer cases the last couple of days, more in line with what they were seeing before that one-day increase. If you wouldn't mind, go to Jefferson County. Jefferson County has not seen that same sharp increase as what we were showing there previously. You can see since about the middle of, just after the middle of January, right then and there, they've seen a kind of a, bouncing around back and forth. We are seeing a slight increase though, and you can see that they had gone below the 15 rate for multiple consecutive days, but now are at 17.7. If you want to like to go to the hospitalization page, Jerry. So with our hospitalized, we added this actually slicing bar, this date slicing bar across the top, so the individuals can see what's happening currently. If we slice down to maybe even the last 6 weeks or last month, you can see again where our cases, the cases hospitalized by date are going. You can see what the hospitals were reporting back just after February 7th, a nice low, very low number, and we were very encouraged by that, 18. We have since gone up to 30, I believe, and then down to 26 as we sit right here currently. You'll notice that the age demographics are very similar profile to the previous, if you took the entire time. The age demographics are very much similar, maybe slightly lower in the 60 to 69 than the 70 to 79 if we took the entire data. So maybe just slightly lower in age in the last month. We probably attribute that to the vaccine, even though we have had some breakthrough cases as Casey Jackman reported from Idaho Falls Community Hospital. There has been a few breakthrough cases with the vaccine soon after receiving the first or second dose, but we, for the most part, we believe that it's still helping and it's skewing that lower. As we're able to get more and more individuals completing that series, we're hopeful that that trend continues, as well as hospitalizations decrease overall. So we'll continue to work towards that end. One last item I wanted to show is page 5, the case details. We have many questions that come up regarding what we might be seeing recently, what are some of those things. This page here can really help individuals get to whatever data really that we have accessible at our fingertips for the most part. So if you can slice the data on the bottom there, Jerry just did, to the first part of February, and then if you click into the cases, you can choose among these things. We'll choose exposure details first, and this will show where we've had exposures as we've done our disease investigation. So households, workplaces, friends, and extended family, and then schools. And that profile has not changed much over the last 6 months, I will say. Those are the ones that we see. Unknowns are again those that we're not able to necessarily contact potentially, or we can't get a hold of. So if we go into household, and we can go by age, by decade here, I'd just like to show you that we are seeing quite a few cases still in that younger demographic. For workplace, again, we'll just take that age demographic off and go to the next one. Yep. You can see that it starts becoming, again, still 18 to 29, but it shifts slightly the other way. So again, you can select your data here on what you'd like to see, including by county, if you're wondering specifically in your county. We have had some questions about our active cases. I will say again, this came up a lot as we were discussing our initial plan with what an active case rate meant. Active cases are those that have not been released from Eastern Idaho Public Health. This is commonly at the 10-day mark from symptom onset. Active cases is how we figure out our rates for our county per 10,000. Many sites do rates per 100,000, I'll just say. We understand that, we recognize that. It was a decision of the board to help individuals in Eastern Idaho with our smaller populations potentially relate that better to what they may be and what they can picture. So rates per 10,000, to get a rate per 100,000, you just multiply by 10 and you'll be there. So again, we do rates per 10,000 individuals. Our rate is not any moving 7-day average. It is not a new cases. It is solely those that are active or that are still potentially infectious that have not been released from isolation yet, which is commonly done at 10 days. That I'd stand for questions if you want to look at any county or numbers specifically.
Further questions regards to the numbers? James, I know you showed, where the transmission may have happened, but can you help us understand? I mean, why did the numbers drop and go so low, and now we've seen an uptick? Because as I've looked around the state, I am not seeing the same thing happening in Twin Falls or even Ada, although they've had some increase, not like we have in Eastern Idaho. Why do you suppose we have here and Twin Falls has not?
Yeah, that's a great question, Chairman Reed. What I would say is we, back in October, and I'm glad Jerry pulled up here the overall case, incident cases. Back in September and late August, we also slightly led the way amongst the state in getting some cases for the fall. And my answer is going to be multifaceted. So I don't want to, it's not just one item, it's multiple items. I think we're probably a little bit on the leading edge, just the way the virus is cycling, with Eastern Idaho coming up first. Second, the mitigation factors. I believe that our schools are in session. Other locations are not necessarily in session. As we saw from those case details, schools do have a role in the transmission. It may not be in the classroom. We've had very few in the classroom transmission type scenarios where both parties are wearing masks, where they're social distancing as available inside the classroom learning. But school still plays a role through other extracurricular activities and bringing people together outside of that in the classroom type settings. So I want that to be clear. In the classroom type settings, we've seen very few transmissions. In the school settings, we've seen potentially more. It is hard to nail down exactly where all the time individuals are potentially getting infected or potentially coming across the virus, as they have multiple risk factors, such as large events. If they go to one, they likely go to other large events. So pinning it down to just one event or one risk factor at times can be difficult. What I would say is we're seeing an increase, and I don't want to oversimplify this, but during many of our case investigations, we're talking with individuals who have not isolated as they become ill. In fact, the number of times we talk with individuals that even after taking a test, they continue to go about their work or their lives, we'll say, until they get the results and they're positive, and then they start isolating. We'd ask that individuals, as they become ill or as they see signs, to please isolate. That will be the biggest aid in reducing the numbers and the transmission of this virus as anything else. So again, staying home when you're sick is a vitally important aspect to helping reduce the numbers. I think we had a propensity to celebrate slightly early with the incoming vaccine, and that's an exciting thing and we're grateful for it. But just because we're getting vaccine doesn't mean everyone's had an opportunity to receive the vaccine. As well as those low numbers have a propensity to probably change people's mindset and feel like we're out of the woods. And I think this is just a reminder for both the vaccine and the low numbers that we're not quite there yet. We still need to stay vigilant on doing those recommendations from public health across the board, including staying home when you're sick, washing, good hygiene and cleanliness habits, physical distancing, and then also wearing a mask when those other items cannot be maintained.
Okay, thank you. Are there any questions?
Mr. Chair, I have a question for James.
Go ahead.
So James, what I took from that, your statements, is that even though we've got these recommendations and in some places orders telling people or suggesting to people what they should do, which is the right thing, which is stay home when you're sick, we still have a significant number of people who are not choosing to do the right thing. And I would caveat that regardless of whether there's an order or it's just a recommendation. Is that an accurate kind of synopsis?
Yeah, Mr. Chair, Bill, yes. I think that we still continue to see individuals put themselves and others around them at risk at times. Okay. Whether there's an order in place or not. Yeah, it's still a recommendation from public health to watch your health and continue to monitor that throughout.
Okay, thank you, Bill. Do you have a follow-up?
No, thank you.
All right. Any other questions?
Yeah, this is Commissioner Young. James, this is probably a little bit early to get any kind of analysis from this type of question, but I'm just wondering, have you been able to see a significant decrease among the groups who have been vaccinated yet, among any age groups or different groups that have received vaccination?
Well, I think the earliest group that we were able to do, and not to put the hospital representatives on the spot, but those are the individuals that we vaccinated very first in this effort. And I think they might be able to tell you what they've seen from their own staff. As we've vaccinated more of the general public and doctors' offices and first responders, yeah, I believe we have seen a decrease in those cases. Those 65 plus, they're just now completing most of those series, right? Because they have either 3 or 4 weeks, and where we started the first part of February. I think it's a little bit too early to tell there, but hospital representatives might have a great answer for you, Commissioner Young.
Thank you.
Any
Mr.
comment?
Chairman?
Go ahead, Doctor.
We've seen a dramatic post the full vaccination of our employees. It's been amazing. I think we only had one employee who was out sick, and it was timing, and that individual didn't have their vaccine. And so it's been wonderful as far as vaccines and the employees. I would also say that we tend to see a lot of employees out ill with respiratory stuff. And, I'm sure hospitals, you'll see us all in masks and stuff for quite a long time. We'll probably be the last ones who stop the masking, or maybe we'll carry it on during respiratory seasons. But we haven't, it'd be interesting to hear from Casey, but we haven't had, our sick days have dropped off amazingly. So I'm quite pleased with that personally.
Yeah, and unfortunately, what we've seen is we do have a certain subset of employees that have declined to receive the vaccine. And that's where the vast majority of our sick days are, is with the ones who have decided to forego the vaccine, and they are, unfortunately, they have a higher rate of coming up positive with COVID. But overall, our sick days are down.
Okay, thank you. Are there any other questions? Okay, Director, I'll let you finish up then, or where you want to go next.
Yeah, thank you, Mr. Chairman. And I'm going to turn to Amy here in just a moment. And I want to say, unfortunately, the state's dashboard is down this morning, not functioning for the vaccine data, which we had planned to share with you all. I just want to say that our staff, as well as many other providers within our health district and our state, have been working around the clock to administer vaccines to people as they become available. We started on April 1st with the 65 and older, and I think we're seeing that we're moving through that group more quickly than we had anticipated. And I'm gonna stop and turn it to Amy and let her give the report, and then follow back up with anything else.
Thank you, Jerry. So yeah, as Jerry said, we started, I think a month ago when we were here, we were just a few days into our 65 plus population, or our 2.2 priority group. As we sit here today, the last month clinics have been very busy and very full. We've seen just a little bit of a change this week in that, with the exception in our counties, with higher populations. So some of our clinics are to the end of their 65 plus list. Even private providers are reporting to us as well that they're definitely getting to the end of their list as well. We've added a clinic here Saturday for the Idaho Falls for Bonneville County, and actually Jefferson County reached out to several individuals on the list there as well, to try and kind of to finish up that list. The state's reporting about 50% of 65 plus population completing at least one dose of a vaccine. The higher that age group gets, the higher the percentage. Nationally at the height of the pandemic, we thought the 65 plus population would be as high as 70 to 80% uptick, but still seeing high uptick with that group as well. So with all that, anticipation of moving to 2.3 March 15th, which will be our frontline essential workers. We're hoping Friday to get some more definition within that group. So we're kind of finishing up on that 65 plus, and then just getting ready to add to the next group, which as we sit here today is a little bit broad. Jerry, James, and I have met frequently over the last several days, just getting preparation for that group as we come along. This week, I'm sure everybody's seen on the news that the Janssen vaccine, or the Johnson & Johnson vaccine, was emergency use authorized by the FDA. That clinic that we are adding Saturday will be with that vaccine. So we're excited to be able to have that kickoff. I don't think our state will see much more after this initial shipment for a couple of weeks, but we're excited to be able to add additional vaccine just numbers so we can get more people vaccinated overall. I wish we had the dashboard. We don't have it, which is unfortunate. But in Idaho, it was, when I looked yesterday, about almost 260,000 people had at least received one vaccine. I don't remember how many of those had completed it with a second dose. Eastern Idaho Public Health our 8-county region. We've given almost 20,000 vaccines. And so again, stayed very busy trying to get that. Also heard some of those reports of, vaccinated individuals still having COVID. I would just want to add that when you look at the studies for all the vaccines that are, on the market right now, they looked at different things. So they looked at, how well did it work against any symptoms of COVID? How well did they work against severe disease, moderate disease? How well did it work against hospitalizations and death? And it varied. So some of those we know there's still going to be some breakthrough diseases, but there's a decrease in how many people die or how many people that are in the hospital. I just glanced real quick when you guys were talking about the healthcare workers. And definitely nationally, there's been a reduction of cases in healthcare workers. And so where they were the early vaccinated individuals, that's promising. The more people that we can get vaccinated, it should decrease severe and moderate disease and hospitalizations overall on that. And without the dashboard to go through, that's probably the end of the information I have, and I would stand for questions as well.
Are there any questions?
I wanted to add one more thing, sorry, on the registry. I wanted to add one more thing real quick. I should have put on here. The state also is kicking off a registration tool. So people that want to be vaccinated as we move into these next priority groups, statewide, they can go in and sign up that they want to be vaccinated. And then providers, so the health departments or private providers can go in and pull those lists from that registration tool. And that should go live tomorrow, right? Yeah, tomorrow. So we've been having some training and looking at that. Maybe that will make it easier for somebody to go on to an individual site to try and sign up for a vaccine. So hopeful around that registration tool as well. And sorry, now I stand for questions.
Okay, Commissioner Mendenhall.
Yes, please. Amy, could you just, how is it decided what vaccination is given with Johnson & Johnson? I understand it's a one-time vaccination. How do you determine who gets which vaccination as we introduce something like Johnson & Johnson in versus the two vaccinations? How do you say Commissioner Young gets the first one, Commissioner Dance gets a one-shot deal because we don't want to see him again? I mean, how do you decide what you do?
As we sit here today, it's easy because it's the current priority group, right? It's the current priority group, which basically anybody calling into that clinic. I think as the studies go out farther, they may lean towards this group. The vaccine may work better or not. I'm already hearing some of that, but right now it's what's available. I don't know that we really get to pick and choose. It's what vaccine I have available. I'm getting into people's arms as we sit here today. So there's not a lot of choice. I think down the road, in a year from now, I'll be able to say, oh, I want to order this vaccine or I want to order that vaccine. But right now it's just what vaccine's available. And then how quickly we're able to get that out there. So really not much of a choice today. The single dose vaccine is appealing as well as a lot of people may choose to get vaccinated with a single dose that didn't want to worry about coming in for a second visit. It's also appealing with that single dose vaccine, maybe to push it out where it's harder to get people in for second dose vaccines. So I think you'll see some of those language or priorities come down farther into it. But I as we sit here today, it's just what's available and getting that into people's arms. Do you want to add anything on that, Mary?
Yeah, I do just want to add on that the recommendation is that people do not wait to be able to get the vaccine that they personally want right now. It's more important to get a vaccine than to hold out for weeks on end until you might be able to get that Janssen vaccine. There's opportunity for illness to occur. Every day you delay getting a vaccine. And so the national recommendation is get a vaccine when it becomes available to you. And then at some point down the road, as it becomes more plentiful in the various options, there might be that ability to choose. But please don't defer getting a vaccine as you wait for a specific one to become available. A couple other things that I just wanted to add on is that last Saturday, in a partnership with Community Family Clinic, we held a vaccination clinic here in our Idaho Falls office for Spanish-speaking individuals. We had about 200 appointments available, and even through our best outreach efforts, we're only able to fill about half of those vaccines. And I think that is telling to us that there is still some hesitancy on the behalf of our Hispanic population of seeking out the vaccine. And I think there's a lot of reasons behind that. We've been working with the state and partners statewide to how to better reach out to the Hispanic community, as well as other underserved communities, not just the Hispanics, but to be able to make that vaccine readily available to them. And we will continue those efforts. We have been communicating again through our Spanish radio, through our partners, community family clinic, and many others, of trying to get information into the hands of people so they know what options are available to them as far as the vaccinations. Another thing that Amy may want to speak on more is that the coronavirus Vaccine Advisory Committee does meet again tomorrow. And at their last meeting, there was lots of discussion of what the Idaho Group 3 looks like as far as priority groups. Originally slated is people 16 to 64 with underlying health conditions and other essential workers. And at the last meeting, they had a lot of conversation about those groups, and specifically people with underlying health conditions. And so we anticipate coming out of tomorrow's meeting, we'll have some more guidance on what that next group looks like. As far as people registering, that the tool that Amy mentioned is going live tomorrow, but Eastern Idaho Public Health has already had a mechanism for people to sign up for a waiting list in future groups. I mean, we're at the point now, after I would say thousands and thousands of telephone calls, that people in any priority group that's currently open can just call us and get on a clinic schedule. As more vaccine has become available, we very quickly work to move people up into earlier appointments. And as we mentioned earlier, we're hearing not just from the patients that are on our list, but others from other providers that we're nearing the end of that priority group to receive the vaccine, everyone in the group that wants it. We are prepared on March 15th to move into the 2.3 priority group. And I do want to just mention quickly, and I have this on our website, who's included in that priority group, because it is a little bit confusing. So this group in green is everyone that's eligible to get the vaccine now. And we need to update this on our website that says early April. It's now March 15th, as reported by Director Dave Jepson on Tuesday of this week. But these are the groups that are going to be eligible next. Food and agricultural workers, including food processing workers. I can tell you that I get many questions of people that are in the food service industry, so restaurant workers, and unfortunately they are not included in this particular group. They're being considered in subgroup 3. Also USDA processing plant inspectors, workers at grocery stores, convenience stores, and food pantry workers. Food pantry workers have been also included in earlier priority groups as we look at community support services. Manufacturing workers. So between ag and manufacturing, we have a lot of people in our health district that are going to be eligible for the vaccine come March 15th. Public transit workers, U.S. Postal Service workers, homeless shelter residents. And as we talk about the homeless shelter residents, that's probably a really good population that we would want to focus the Janssen vaccine. That's just a 1-dose vaccine, because we don't know that we would ever be able to see some of those individuals again. And so getting them as much protection as possible is going to be critical. And then another group that there's a lot of questions about is this subset of essential gas, electric, water, and telecommunication workers. And I just want to explain in further conversations with the state that that is not all workers. It is a very select number that the Idaho Public Utilities Commission worked with the governor to include in this group. And so we're trying to get additional information so we can make that available to the workers in this group to understand where they fit or where they may not fit in this group. But I know there's a lot of questions about that one, as well as the restaurant workers. And so as we get more information from CVAC and from the state, we'll certainly make that available. We had a conversation with them yesterday about trying to help us clarify as much as possible for the public of where they may fit in the priority groups. And we anticipate having more information to share very soon. So on the registration list that we have for 2.3 is still applicable. And even as the new tool goes live tomorrow, we will still use the people that have signed up on our waiting list and reach out to them to get their appointments scheduled for the first clinic that we have available when that group opens up. And then from there, we will start using the statewide registration tool to pull those names down. So I think we will also hear a little bit more in the CVAC meeting of the timeline for the next priority groups. And so we are looking forward to that meeting tomorrow. Are there any other questions on the vaccine piece?
Mr. Chair, I have a question for Jerry.
Go ahead, Bill.
So Jerry, on the food and agricultural workers, why wouldn't the restaurant workers be included in that? They seem to be the ones that are most vulnerable to being people coming and going.
Bill, that Commissioner, Mr. Chairman and Bill, sorry, that is a good question. And the CVAC committee, and I don't know if Amy wants to speak to this more, but has been using the guidelines that came out with CISA, which I did identify, the essential workers as we were speaking of those early on back in March, but also some other recommendations with different priority groups, and through ACIP, the Advisory Committee on Immunization Practices, also had some of those designations. The food and agricultural workers, including food processing, many of those are in close working conditions. And I think that's why they're included here. And you're right, food service workers are on the front lines every day as well. But again, masking and physical distancing should still be being implemented by everyone until they're able to get the vaccine. I don't sit on that committee. I don't pretend to understand why the governor has also made some of the decisions, but we simply are following the guidelines that have been set forth for our state.
Thank you, Jerry. Just one follow-up.
Go ahead.
I was in Idaho Falls the other day and decided to go into one of my favorite pizza places to get a pickup pizza. And when I walked in, I noticed that behind the counter, there were probably 8 workers well within 3 or 4 feet of each other, and not a one of them was wearing a mask. Obviously, I decided not to get a pizza there, but it was just kind of disheartening to see that there was that many workers together who potentially could be spreading the virus right over the food that they're preparing. So, thank you.
Are there other questions on the vaccine? Or?
Mr. Chairman?
Yes, go ahead.
This question is probably for Amy, but I get this asked a lot. How long does the shot last? Is there any idea? Or
There's not. I mean, again, we don't know how long immunity from the disease lasts, and they should be similar. And so we just don't know that yet, especially with the variants thrown in there a little bit. So yeah, the $1 million question.
But Commissioner Shenton, I would just add that as time goes on and additional data becomes available, we'll be learning more, right? And be able to know that answer, but it's going to take time for that to happen.
And they're doing lots of studies, longer term studies out there with even different dosing of the vaccine. So yeah, just to add to Jerry, the longer we go, the more we'll know.
Thank you.
I would just throw in that my belief is that we're going to see the COVID-19 vaccine be at least an annual shot, just like we see with influenza.
Okay, are there other questions?
Commissioner Young, Mr. Chairman, I know the numbers are not always what they seem in these trials on these vaccines, and I wouldn't mind having somebody address this question among our experts, health board workers, Jerry or James or Amy, or even our doctors, Dr. Nelson, addressing the one vaccine is better than the other. Like the Johnson & Johnson drug, it only works 70% of the time with the efficacy studies, but I know the numbers are not always what they seem. Can they address that so that people maybe don't wait because they want a certain vaccine?
You don't want to wait, because if you're not vaccinated, then you're 0% protected. And it's complicated. I mean, even the various vaccines are complicated, 1 dose versus 2 doses. It's a little bit apples and oranges. Again, some of those efficacy studies are against different parameters. So some are against disease, some are against any symptoms, again, hospitalizations. Some of those vaccines, the single dose, you have some immunity 2 to 4 weeks compared out to full, better immunity with the 2 dose 4 to 6 weeks. And so it is complicated if one's better than the other, because even in those clinical studies, they didn't compare the same thing. So again, I think it's time. I think in time we'll know how well they work in which settings. But I would try not to get hung up on the efficacy. I guess just the bottom line is they may not even be the efficacy against the same thing.
Okay, thanks, Amy.
Dr. Nelson, would you have anything to add to that, your experience with vaccines?
Yes, I read a recent report that showed the protocol for the testing of the Janssen vaccine actually had the participants in the clinical trial with more risk for exposure than some of the previous studies. So I wouldn't hold too much about the efficacy being a bit lower, because it was the study designed what had a little bit higher risk.
Okay, thank you. Any other questions? Okay, I did notice, I was looking at the state dashboard last night, and I see Eastern Idaho Public Health has 100% of their vaccine out. So I'm fairly confident that you have not had any vaccine go to waste. You guys, I know, have worked extremely hard to make sure that every dose has been used. Is that correct, Amy? Anything to add to that?
Yeah, no, we work really hard at the end of every clinic day, even when we're off-site, when we come back, we're making phone calls to have individuals meet us back here so that we can use those end of day doses. And it's challenging. Every one of those clinics are challenging, but no, our staff work really hard to assure that we're able to get those doses into people's arms at the end of the day within the current priority group.
Mr. Chairman, if I could just mention, as you brought up the vaccine dashboard, you will notice a change on there that it has Eastern Iowa Public Health. And again, that is Amy and her crew of immunization staff that are vaccinating people at Eastern Iowa Public Health sponsored clinics. And now you'll see a new provider on that list. It's called EIPH distribution. And that is kind of like the clearinghouse or the brokerage, I would say, that's administered through James's program, the preparedness program, that accepts that vaccine for our entire region and then allocates that vaccine out to all of the providers within our health district. And so you might notice that that is always orange. You don't see any blue. And the reason for that is because they're not administering vaccine out of that particular provider name. It's a brokerage that accepts the vaccine from the state and then reallocates that to all the providers in our region. And James, would you just mention kind of the vaccine projection allocations?
Yeah, so with additional vaccine coming from both Pfizer and Moderna, as well as the anticipation for Johnson & Johnson, we'll be receiving more vaccine into our district. Primarily though, from actually the distribution formula changing across the state. Through this week, we'll be receiving vaccine based off of our 65 and older population. So across the state, we have about 10% in our district of 65 and older of the state's population. So we've been receiving about 10% of the vaccine into our district. Going forward, starting next week, we'll be basing it off of population or overall population of our health district, which is almost 13%. So we'll be getting more vaccine due to that change, as well as we continue to see increases in Pfizer and Moderna allotments, as well as the Johnson & Johnson or Janssen vaccine later on this month. Again, we're getting a small initial shipment today or tomorrow for the Janssen vaccine, probably nothing for a few weeks, and then starting up again late March with the Johnson & Johnson vaccine from our latest information from the state and federal government.
Okay, thank you. Amy, I did want to clarify. Again, on the state dashboard last night, I'm fairly confident that I saw our health district at 27,000 vaccines given. You said 20. Am I remembering wrong?
Or I'm remembering wrong.
No, the 20 is what EIPH has administered. The 27,000 is our entire health district, all the providers.
Okay. So there is 27,000 total, but you guys have done 20,000 of them. Well, you're to be commended for the incredible amount of work that you're doing, not only in the vaccination clinics that you're overseeing and taking care of, but the distribution, right, to spread it out amongst all the providers. So I know it's been a load of work for you, so thank you. Is there anything else to add?
I don't, and thank you, Commissioner Reed as well, Chairman Reed, for helping us at a couple of our clinics get set up as well. Appreciate that.
Oh, it's been a pleasure to see it in action, see all of you in action, and it's been quite, it's been wonderful to see so many volunteers that have come through and are helping you at those clinics as well. So appreciate all of those, everybody who's a part of it. Well, Jerry, I'll go ahead and move on to the agenda then. I would like to move now in our agenda to item 11, which is the report from our division directors. So I think we continue with you, Amy, for the hepatitis C treatment program.
Thank you. Yeah, so I just wanted to give an update on the hepatitis C treatment. I think, I don't know, 5 or 6 months ago, it's nice to do something non-COVID as well, but I brought, I think I did a presentation on hepatitis C in our health district, wanting to look at helping individuals navigate treatment for hepatitis C. Just a little refresher, most individuals that contract hepatitis C end up with chronic disease and illness, leads to liver cancer, liver failure, and just a lifelong expense, and high, mortality, morbidity, both with that. And so we talked to the state about getting a little bit of funding federally to help with individuals to navigate through a treatment and ultimately a cure of hepatitis C. And we had had our first client start that treatment at the end of last year. And then just about 5-6 weeks ago, did a follow-up viral load on her and determined that she was cured of hepatitis C. And so that was exciting to be part of something that completely eliminated a disease from somebody. And then this week, we've actually just helped somebody help navigate through that same process and started a second individual on that. That medication is very expensive. I don't know if you guys recall when I was during that presentation, can be as high as, $80,000 for a 12-week treatment. And so basically what we're helping them through is if they're uninsured, to help them navigate a patient assistance program, or helping them work with their insurance to get that paid for. And a lot of people just aren't able to do that. And so then that develops into that chronic disease. So we're excited about that. And we're excited to be, hopefully now maybe present that through the whole state now for the other health districts to jump through that same process. So very exciting news. I just wanted to give that update.
All right, thank you. That is good news. We'll go ahead and move next to Mallory Johnson with our drug overdose prevention program.
I'm just going to pull up a presentation. Thank you for having me today. Okay, I hope you can see that.
Yeah.
Right. So I do the drug overdose prevention program. It focuses on advancing opioid prevention through public safety partnerships, public and prescriber education, and then local capacity building and social determinants of health. So what we've been working on is different drug overdose prevention and response trainings. These trainings encompass opioid education as well as how to administer naloxone. And so with our public safety, we provide this training to ISU's Idaho Falls Campus Public Safety, Fremont County EMS, Gibbonsville Quick Response Unit, Lador Ambulance Services, and then Lemhi County EMS with Elk Bend QRU. And today, next week, and in June, we'll be doing one with Idaho Falls Police Department. And then with our public, we've provided this to the Center for Hope and the Crisis Center, a bunch of different of their groups there, Community Youth in Action, Fremont County Race Meeting Group, Madison Cares, and then later this week we will be presenting to the Idaho Falls Geo Reentry Group. And then next week we'll be part of Idaho Safety Fest with the College of Eastern Idaho. And as we've been doing this, we've found that 36% of people before this training had no knowledge of naloxone. As a result of this training, 96% said that they felt comfortable enough to administer naloxone, which we're really excited about. Something that we share in the trainings are these little doTERRA drug deactivation bags. Hopefully you can see them. These are really great tools. This is something that Danae, she does the Partnership for Success grant, and she does underage drinking, meth, and marijuana, but we're able to partner together. And her grant pays for these, and we're able to talk to people about how to safely store and dispose of prescription medications. Before this training, 86% of people either agreed or strongly agreed that they had no knowledge of doTERRA deactivation pouches, and after this training, 98% of people said they strongly agreed or agreed that they feel that they know how to use these, which is really exciting. This can especially help in our rural communities for people who don't have access to a drop box or they don't have one close enough that they can still dispose of opioids or over-the-counter medications, different medications in these bags. So that's really exciting. Another thing that we're working on is our Narcan boxes. So they look like this. We're working on getting 10 of these in the beginning, and then we hope to kind of expand from there. But with these Narcan boxes, we've reached out to all of the high schools. There's a Narcan community grant that would allow for us to put Narcan in the high schools through that community program. So North Fremont High School, Ryrie, and Teton are the schools that are interested at the moment. Some of them are working on policies with their district to make sure that they can have Narcan in the school. And then we've had people from Idaho Falls High School and Lador mention or kind of reach out to us to ask some more questions. And then we're also hoping to get these, the St. Anthony Police Department, when we did the naloxone and opioid education training with Fremont EMS, they were there and they asked if they could get one of these for their courthouse. They really want one for the Senior Citizen Center, and they also want the deterra bags there. The state office nurses station mentioned about how it would be nice to have one of these boxes, and then Upper Valley Child Advocacy Center. We've also had some people ask if we can put them in places like Community Youth in Action and different community centers, which would be really great to have this. It also, when it's inside of it, I'll stop sharing my screen for 1 second so you can actually see inside. There's a CPR mask, and then there's a instruction kit that will tell somebody how to respond to an opioid overdose, and then Narcan, which contains 2 Narcans in and of itself inside this little kit. And so having this hanging up would help to rescue and combat an opioid overdose. And so just having it available would be really great. And then just the last thing I wanted to share is, as we've been working with some of these organizations, we've realized the need for resources and a better, kind of clearinghouse. We have on our EIPH page a manual from 2018 that has a list of community resources. And with my grants doing local capacity building, I'm working on updating that. And then our plan is, these are QR codes so that they make it really easy for someone to scan. We want to put these on magnets and stickers, window clings. And we have a lot of interest in these, that people want those so that we can hand them out to the community, so that by the time that they get this, it'll still be up to date because we can scan it, and then everything can be up to date on the computer instead of printing a manual that then is outdated. And so we're really excited. We hope that we can get these out more towards the end of the summer, but this would be really great for our community to link them to different resources. And so that's what I'm doing for my grant, and I stand for questions.
Are there any questions? Well, thank you for everything you're doing. I've heard multiple times how many lives that Narcan is saving. I've heard it through our sheriff's office and other places, and so it's certainly important work that you're doing, and thank you.
Thanks, Chairman Reed.
So we'll go ahead. Oh, yes.
Commissioner Dance, I just would recommend that any of the county commissioners in their board of commissioner meetings consider inviting Mallory and her group to come and make this presentation. It's worthwhile.
Very good. You must have had that in Fremont County. So thank you. Great recommendation. I will certainly try to get that scheduled here in Bonneville County. So we'll go ahead and move next to our WIC food package update from Angie Harwood. Good morning.
Good morning. Thank you. Yeah, just a quick update on the state of WIC and some changes we'll see in the food package. This past month, the National WIC Association released a publication called The State of WIC. And in that, they highlighted some of the accomplishments of the WIC program through the year. So I just listed some of that here for us to see. Through the COVID response, multiple waivers have been issued to allow us to continue to perform WIC services. And the most impactful of that is the waiver of participants not requiring a physical presence, so we can provide the services remote or over the phone. Early on, some of the waivers included food package allowance changes, and the grocery stores were having a difficult time stocking their shelves. And then you can see on here, 51% of eligible individuals in the United States are participating on the WIC program. And For every dollar spent on WIC, $2.48 is a return investment. So WIC's a good investment. You can also see the number of participants we have nationwide. So just under 8 million, and that also breaks down where those fall with our women, infants, and children. Getting a little closer to home, that report or that publication also gives some information on Idaho, and we have 39% of infants born in Idaho participating on the WIC program. 42% of eligible individuals in Idaho participate on the WIC program. And our total participants are 37,264. And what that looks like for Eastern Idaho Public Health is, these are our numbers I pulled from January for enrollment and participation. So just over 6,000. This time last year, when the pandemic was new, we had closer to 6,400 enrolled, and we've seen that level off and maintain numbers pretty well through the past year. One thing that's been interesting is we've seen our enrollment and participation rate increase significantly. So participants may be enrolled, meaning that they qualify for the program, and but maybe they're not using their benefits or attending all their appointments. And so that's kind of the enrollment participation rate. And prior to the pandemic, that was in the high 80s, and now we're in the high 90s. So we're seeing that people that are participating in WIC do need the WIC services. And then just an overview on some of the response that we've had to provide services. And some of this I've talked about before, but we again are providing remote WIC services. What that looks like is we have staff working in Idaho Falls, Rigby, Rexburg, and Salmon to schedule appointments, mail out benefits, and handle that end of it. And then the majority of our staff are telecommuting, and that those staff are providing the certification appointments, the health screen appointments, and education over the phone. And with that, that's worked out pretty well as we've been giving vaccines in our health district. Much of the WIC physical space has been used as a COVID vaccine clinic space. So that's been a benefit in that way. We continue to provide breastfeeding support via Zoom. Our breastfeeding peer counselors are providing individual support, and then classes over Zoom. And then curbside assistance, you can see there one of our staff is taking WIC benefits to a participant in their car. So for participants who can't wait to get their eWIC card in the mail, and maybe it's a more urgent need, if they're able to get to one of our offices that we have staff working, we'll deliver that to them. And then new this last month, we started an online application where participants are able to go to our website and apply for WIC, and then in a secure way upload their documents. So, we're needing ID and proof of residence and different documentation for this program. So it makes it a lot easier for our participants to apply for the program. And then moving forward with the food package, there is some legislation with the American Rescue Plan that was passed in the House and moved to the Senate to increase the value of the fresh fruits and vegetables that we give participants. So right now we're giving $9 for children and $11 for women, which is pretty low amount. This would increase it to $35 for children and women. So we're hopeful that that will pass. If not, probably moving forward, we're still going to see an increased value in the WIC food package, which we're looking forward to. And then other things moving forward is there is a large pilot program looking at participants using their WIC benefits for online ordering. So that's an option for participants that they don't have to go into the grocery store if they'd prefer to order online. So lots of good things coming.
Thank you. Are there questions? All right, well, thank you very much for what you're doing and for that report. We'll move next to our environmental health, Kelly Johnson.
Good morning. So I join you from our environmental health classroom. This is actually what we use for the public to come and join any of the meetings. So just wanted to let you know that we're helping every way we can to serve the public here. So I'm just going to go ahead and share my screen. I've got some different information to share. So what we are working through in our septic program, just wanted to let you know that we had a audit and it was done via remote from the State Department of Environmental Quality. The audit itself occurred in late October, and we received the results into December, and then we had time to work through the audit, potentially challenge or help provide any information that maybe the auditor did not find through our electronic database while they were doing the audit. So the outcome, actually, we received it final in January. The biggest thing that we've found for audit findings, and it was for both basic systems, so those would be your very simple installations with the septic tank and drain field, to our complex systems that may require a pump or an advanced treatment, is just the lack of showing on our paperwork or our plot plan is where maybe where a test hole was actually seen by a staff member. It would not change the quality of the inspection. It wouldn't change the quality of the installation. It was just more with staff not putting the X on the box or in the box per se. So we are working hard with our staff to make sure that going into this new season, that will not be missed nearly as much as what it was over the last audit. In our defense, we were very busy. We were down staff. Staff were still working the full program. So something as small as that as a finding, we felt like was a very good outcome overall for our audit. We are working through updates as well in our database to make sure that things that maybe were smaller in findings, like maybe missing a box saying if it was a basic or complex system, we're working with our database vendor to make it to where certain parts of our form, when staff are filling it out, will be mandatory before they can actually save the document. So we're going to be doing more to help the staff not have these very small amounts of errors when it comes to our audit. So we've been working through these improvements. We've had Zoom meetings with staff talking about what errors we had through the audit, what to do with the QA process before they actually finalize an inspection, make sure that they did include the test hole location, they marked all the boxes. So we do feel like we're going to do much better in the coming audit year. Just wanted to let you know that that was done, and we have been working very hard in the program. As we were doing some improvements to our database, we had some timely memos come to us from the State Department of Environmental Quality, and I'm going to share those with you as well. With the changes to our database, we're going to be including some changes also to the language. And this came through a memorandum from DEQ just earlier in February. And so you'll see this paragraph here down at the bottom that talks about permit.
We can't see the memo.
It's a new share. I'm still figuring out this technology. I apologize. Thank you.
There you go.
So okay, I apologize again. So this paragraph that we're having to add, we're going from what used to be like potentially 3 sentences on our permits to this paragraph language now. So it's going to take up a little bit more space on our permits, but this language was found to be needed because and you'll see within the paragraph, it talks about operations, maintenance, and monitoring. This is very specific to types of installations where there may be an extended treatment package system or an ETPS system that is installed to actually protect the groundwater because it's very shallow on a property, or they may have bedrock, which is a limiting layer. And so they need to be treating the effluent to a better quality before it actually goes into the ground and into the future water table. So the language is going to be very clear now on the permits to mention the fact of this operation and maintenance and monitoring. Before, we did not have that in the permits, and this is statewide now being asked to be included. And so in the future, if individuals that are required to have one of these types of systems don't do what's needed, then the State Department of Environmental Quality can support us with any potential enforcement actions. Without this language, they felt like they were not going to be able to support us. So we just wanted to make sure that the language is included in our permits. We're working with our software vendor, as mentioned already, with some of the audit improvements. And so this language, we should have worked with our auditor, with our software vendor to have this language available for our permits as early as next week. So we're excited for that because we're able to add that work to the septic program in addition to those improvements I talked about earlier. And then finally, another memorandum from the state Department of Environmental Quality is the requirement when property potentially, expands multiple properties. So with this, hopefully you can see that.
We cannot yet. There you go.
So this is taking up quite a bit more space. And what the reason for this is there was an actual challenge in the septic program somewhere that actually went to the state Supreme Court. And I can't speak right now. I apologize to which state that occurred. But when the State Department of Environmental Quality became aware of the challenge and the dispute of a property owner that maybe has two properties and the septic system spans over the two properties, there was in the past a requirement to have an easement recorded, and that easement was found to not be necessary now. So DEQ has worked with the health districts to come up with language and to add to our permits if this is applicable. And due to the complexity of the education to the property owner, DEQ felt as it was needed, and this was vetted through their Attorney General's office, all of this language, and it does unfortunately span over 2 pages. So as you can see, multiple paragraphs is now needing to be added if this is applicable to a permit that we will be issuing in the future. And so we are working again with our software vendor, and this is going to require that we add an additional page to our permit if this does become an issue within our health district. And it's education to the property owner that if they should potentially sell a neighboring parcel, and that's potentially where the septic system, maybe their drain field is located, they should be working with that future property owner to make sure that they have access, as it would be an easement in the past, to try to make sure that their system is not going to be impacted or potentially cut off. So this language is very important to have for situations like this. It could be generations down the road that maybe a property sells and the original person that had the system put in does not know about this occurrence. So this language will be recorded on the permits, and the education will be there if they should happen to sell the property, to allow them time and hopefully the right education to get their system secured with that future property owner. So again, quite a bit of language, but our software vendor is working very well with us, and we actually share the same software vendor with Health District 6, our neighboring health district. And so the timing is great to be able to share the cost of these 2 memorandum language. So the cost is going to be split between the 2 health districts. So if nothing else, the timing is right. We were already doing some improvements again to our program for our septic program to do better with our future audits. I'm going to be moving into another program now, so I don't know if anybody has any questions specific to the septic program and the information I've shared. I know it's kind of a quick presentation, but just wanted to let you know that we're working hard to meet the needs, for our program specifically.
Any questions on the septic program? Okay, go ahead, Kelly.
Thank you. So let me pull up our next document and I'll get this shared. So just a quick FYI to everyone, in our childcare program in fall of last year, there were new requirements to facilities, just requiring more paperwork being available to us as inspectors when we show up. And it is contained in education that we provide to childcare providers that are new. And this information was shared with providers around the state from Department of Health and Welfare when these requirements became new to them to have to meet the requirements. So starting in October, we started to inspect to these standards. And the biggest that I just wanted to make you aware of, it requires that anybody that's on the premise that's 13 years of age or older is required to have a background check, and that background check information does need to be made available to us to see. So that is taking, unfortunately, more time for us on the site when we're doing inspections. Some providers, for some reason or another, aren't familiar with this new requirement. So when we are on site and we find somebody that does not have the clearance material or their clearance has expired, these clearances are only good for 5 years. And so we found that some have expired. So it is required that those individuals leave the premise while we are there, and they cannot return until their background check paperwork is complete and provided to us. So the concern with this is when somebody needs to leave that is part of the supervision of the children on the site, that can affect the ratios as well. So there are times when they've had to call in other staff that maybe weren't working that day. They may have to have parents come and pick up children because they are not able to be in ratio. So it is quite a burden, not only to the facility, but maybe to the parents, and also definitely to us on our time on site if situations occur from this lack of paperwork. And then in addition to the background paperwork, also everybody on the premise at a child care facility that is in direct supervision of children are now required to have CPR first aid, specific in pediatric, that we have to be able to, again, see the paperwork. So in the past, it used to be that only one person had to be on the premise that had this certification. So now that is another additional obligation to the providers to have their staff trained. So it's not as severe if we find somebody in violation to this. The provider can get somebody hopefully educated in 30 days. We can give them 30 days to correct this violation. The biggest impact is that person cannot be left alone with children or directly supervise them because they do not have the proper training. So that does take another staff member and maybe some complications again with ratios. So the reason for today's education is just to make you aware of these two added responsibilities to our childcare facilities, because it does end up being at times a bit of a complication when we're out doing inspections. So we just wanted you to be aware that, these standards are set by Department of Health and Welfare, and we're pretty much the eyes and ears in the field when we're doing the health and safety inspection, finding these things and, being responsible to make sure the facility is in operation according to the rules while we are on the premise. So that was the reason for those documents being shared today.
All right, thank you. Are there any questions from the board for Kelly? Well, thank you, Kelly, and thanks for the report, for being there in the meeting room with us there at the East Idaho Public Health Building. I want to thank all of the division directors and all those program directors. There is so much that goes on at Eastern Idaho Public Health, And the past year, there's been a lot of focus, understandably, on the pandemic and COVID-19. But while all of that's been going on, there has also been all the other good work that comes out of Eastern Idaho Public Health for our community. So thank you to each one of you. So we'll go ahead and move next on our agenda. It was requested by Bill Lake to move item number 7 to this point in our agenda. I would caution the board that where there is a consideration for the plan, a change to the plan, that to be cautious going forward, because we've always used that plan and what we would do with our health orders. But I'll go ahead and allow the discussion on it, and then we'll see where it goes from there. So I'd like to ask Jerry if you would just kind of let us know where we are as far as current health orders in our district.
Yes, Mr. Chairman. So we currently have public health orders that require the use of face coverings in place for Teton County and Madison County. At this point in time, Teton County has met the metric that is currently included in our plan to be under a rate of 15 per 10,000 population for at least 14 consecutive days. With that being said, the last 2 days, Teton County has bumped up over the 15 rate now. So I have prepared the order to lift the restriction in Teton County that would be in accordance with our plan.
Okay. So they are under the metric in our current plan. And how many days had they been? How long had they been under that plan? Because I know we'd seen a lot of emails and received calls from members of the public in Teton County requesting that we look at that because of their long time under the 15.
Yes, give me just a moment and I will pull that up. I don't have the number on the top of my head, I apologize. But this is a good opportunity again to show our dashboard so people can understand all the information that's included here. I'm going to go to the county level response and choose Teton County. And I'm going to slice this down to a more recent date. And then anywhere on this where the chart is, you can right click and choose show as a table. And then it puts the numbers right there, easily accessible. So I'm looking days, they've been up over 15, but then prior to that, they had been under the 15 per 10,000 metric since February 11th. So I didn't count those days, but 20 at least.
Okay.
May I just also say that a lot of the questions that we have been getting is why, since they're under the metric, have we not moved them to green? And the answer to that is because a public health order is in place. And to remove that order does take action of our board. And that is what's being considered today at our board meeting.
Okay, thank you. So we'll go ahead and open it up for discussion. Bill, go ahead.
Thank you, Mr. Chair, and thank you, Jerry. I'll start with, I had a meeting on Monday with the local community leaders, the mayors from all 3 cities, Teton Valley Healthcare, and the chair of the Board of County Commissioners. And we discussed where we were with COVID-19 here in Teton County, understanding that we did meet the criteria to be lowered from yellow to green and to lift the order. But the concern in Teton County by everyone is that we're kind of in a unique situation. We've seen more out-of-state people longer than any time before. The Grand Targhee Ski Resort, almost daily, except for the last few days, You haven't been able to get up there and park. They've been backing up parking. So there's just way many people in the valley than we've ever seen. And that's attributed to a couple of things. One is we got a great resort, great snow, and Targey's opened up to allow certain people with cards you can get to come to the ski area and get a cheaper lift ticket. We've also noted that there's a lot of people that are working from home in Teton Valley that are from out of state. So we've got a lot more activity here. We also have across the border, Teton County, Wyoming, who continues to see a very high level of active case rates over there, and recognizing that a lot of people from here work in Jackson, and we're also seeing a lot of people from Jackson that come over to work here. And we get a lot of people coming over from Jackson to ski here, and then they stop at Brolam's or one of the restaurants in town or one of the other businesses to do that. So with that said, the consensus of the group was that we would really prefer to see a transition out of the order rather just than a one day make a decision to lift the order and have to deal with the media and people's perception that the order's been lifted. However, noting that the cities and the county have orders in place for mandating mask and size of gatherings. So we're unique again in another situation where it's not just the public health district lifting the order, and we found this back in the summer when we lifted the order, that immediately most of the businesses, many of the businesses came out and put signs on their doors that says no longer required to wear masks. Even though the recommendations and the city orders were in place. We need time over here to go educate all the businesses and the people. We think that's going to take 2 or 3 weeks, that on a certain date, the order will be lifted and not put back in place. And right now we're 1 day away from actually having to put the order back in place because we meet the 3-day requirement. And we don't want to do this flip-flop thing, even though we may change the order here shortly to do away with that requirement. So I think what the census of Teton County, the local community, is to have the order go away April 15th. That's around the time that Target closes, and we're going to see, much fewer people in the valley. But keep in mind that come early June, we're going to start seeing a huge influx back into the valley as summer gets here. And we've been having record numbers, even with COVID, in the national park. So with that said, I could go through a laundry list of arguments of why to keep the order in place, that people do not necessarily, a lot of people see the order as not just a recommendation, but yeah, you do this. And the public health has a lot of influence. People will follow the public health order and not necessarily the local city or county orders or recommendations. So that would be our recommendation, is to make the order, lift the order effective April 15th. If that's too far out for everybody, we start spring break here March 26th with the schools. We would even look and probably consider maybe the end of March or March 26th as being a reasonable date to lift the order. So with that said, I will certainly take any questions or turn it back over to Chairman Reed. Thank you.
All right, thank you, Bill. So the question I would have is, my understanding is there are requirements, health or face covering requirements in the city of Victor and the city of Driggs. Is that correct?
That is correct. Well, throughout the county, because the county order also has that requirement.
Yes, on top of ours. So the question I would have is why those couldn't be set at a date and you could use those orders to put out your information of when they will be lifted, and if there's ever been any enforcement of those city orders.
Well, there has not been any enforcement, just like there hasn't been any enforcement of the public health order, because we just don't have the resources or the trained staff, sheriff deputies to actually do that. Plus our sheriff said that he wasn't going to do it anyway. So, and I think that's what we're trying to do here is coordinate between the cities, the county, and the public health district, because we know from experience, if we say the health district order is lifted effective, say tomorrow, that to get all those other people educated, that doesn't really matter because the city and the county orders are still in place. We need at least some time to be able to educate everybody as to how this is going to occur with coordination between the city and the county orders and the public health district order.
Okay, is there other questions or comments from the board?
Mr. Chairman.
Go ahead.
I wanted to piggyback a little bit on a comment that Bill made, that it's been a concern of mine, and we haven't discussed Madison, but it dovetails in a little bit with removing restrictions and health orders. One of the things, and one of the biggest complaints that I receive is that we have no exit strategy. We are, and please don't take this as a foolish statement. Well, you can if you want, but we are more under control with the pandemic now than we were 10 months ago. Whether it's vaccinations, the hospital reports were a lot better than they were even 6 months ago. And what I'm looking for and what I'm hoping, and it came off of Bill's comment of you know, how do we begin to have an exit strategy? How do we mitigate out of this normal? I don't know if that'll ever happen. I'm not advocating that. I'm just saying there hasn't been enforcement, but yet people have stepped up. There are those that refuse to wear a face covering. There are those that you see leave the restroom and they didn't wash their hands. They didn't do it before. I like the idea of education. We got into this by educating people before we issued health orders as a health district. We were educating the staff there in the district office before this even became that big of a deal that it is now. Had the posters, they had the education, they had the public announcements of wash your hands, wear a face covering, avoid contact, stay 6 feet apart if you can't wear a face covering. And I am hungry for an exit strategy, and it's with Madison County as well. We have watched our numbers roller coaster, and as has Bill, and I'm not sure we can attach it to any one thing or any one season. We seem to go up and down, but we're not going up and down as much. And how do we mitigate that? How do we bring sanity to the season of insanity? I don't know, but I just listened to that with Bill, that people are wanting to know what can we do to start to taper this off. And I don't know if we can. And I would go to James or Jerry if we can or can't. I don't know, but it ties in with Madison County as well, and a recension there.
Other comments, Commissioner Young?
Yes, Chairman Reed, with what Commissioner Mendenhall said, and I'd like to delay the the rescinding order or whether we do it or not. I'd like to delay that until after our discussion with the next item on the agenda, the revising of the regional response, to see what comes out of that, and just. I think it'd be pertinent to delay that until after that discussion. So I'd like to make that motion.
Okay. I'm not sure it requires a motion, but I appreciate that, Commissioner Young, and I understand. So without objection, we'll go ahead and let's go to that next item. We'll take no action on rescinding any orders at this time. We'll go ahead and move to item number 5 on our agenda, and have that discussion now about the response plan. Maybe that'll play into what Commissioner Mendenhall was looking for and help broaden our discussion a little bit. So Jerry, would you go ahead? I understand that you have some recommended revisions to our response plan.
Yes, thank you, Mr. Chairman. And before we actually pull up the plan and talk about that specifically, I just want to take you on a journey, a recap of our last year. We're over a year into this COVID-19 pandemic response, and what a year it's been. I can confidently say that has impacted every single one of us, every single one of our community members in some way or another. But if you'll just indulge me for a minute to recap the last year to get us where we are today. So back in February, just like was been mentioned, Eastern Idaho Public Health saw what was happening across the world as the pandemic started to invade the United States and ultimately Idaho. We began providing education and information to our public about the new virus that we were seeing and promoting the everyday preventative measures that people could take to protect themselves from the illness. And that did include staying home when you're sick, just like every other illness, washing your hands, those basic hygiene efforts, and then keeping your space from other people that were sick. On March 13th, Idaho experienced our very first case of COVID-19. It was in Blaine County, followed the very next day by the first case of COVID in our 8-county health district, March 14th in Teton County, Idaho. Y'all remember that the early response was managed by Governor Little and Director Dave Jepson for Department of Health and Welfare. It was in April that the Centers for Disease Control and Prevention started recommending that people do wear face coverings to minimize the spread of respiratory droplets that carry the virus from one person to another. In July, things had improved and Governor Little turned the COVID response back to local jurisdictions. And since there was no vaccine to prevent the disease or any specific treatments for people that had contracted the infection, our goal in our response was to do everything we could to slow the spread of the virus in an effort not to overwhelm our hospital and healthcare systems. These same efforts would also do everything possible to keep our local businesses open and ideally our kids in person in school where we know that they learn the best. At that time, Eastern Idaho Public Health developed a plan, and that plan was not based on case counts, but on the anticipated number of hospitalizations that would result from positive cases of COVID-19. The plan adopted by the board included the issuance of public health orders that did require people to wear face coverings when in public and also placed restrictions on gatherings at different levels. And again, all this was done in an effort to slow the spread of the virus. Over time, as cases and hospitalizations increased, we were in close communication with our hospital partners to assess their capacity, just like we did today. We gained more knowledge of the disease, as well as our collective ability to care for patients affected with COVID, and multiple times we made adjustments to our plan based on that new information. As cases began to spike in mid-November, with days of over 300 cases a day being reported, we were seeing 65 residents of southeastern Idaho in our local hospitals, as well as more from out of our area being hospitalized for COVID. And you know that this put tremendous strain on our healthcare capacity. Even worse, at that time, there were daily reports of our family members and friends and neighbors who were losing their battle with the devastating disease. And to date, we've had 219 people from Eastern Idaho lose their lives to COVID-19. And that ranged from people in their 20s up into their 90s. When I look back at December 14th, that was a day that came with great hope and anticipation that we could eventually see an end to this pandemic. That's the day that we received our first vaccine and we're being able to administer the first doses of vaccine to healthcare workers in our public health district and our state. In the following weeks, residents and staff at long-term care facilities which were very vulnerable populations to contracting and ultimately dying to COVID-19, were able to be vaccinated, as were first responders, school teachers and staff, and many others. As I mentioned earlier, a month ago, we began vaccinating people that are 65 and older. Again, another population that is very high risk for severe disease, hospitalization, and death from COVID-19. And we sit here today, we know that in just a few short months, everyone in Idaho that wishes to receive the COVID-19 vaccine will have the opportunity to do so. But until then, we all need to continue doing the mitigation measures that we know that minimize the spread of the disease. Again, stay home when you're sick, wash your hand, avoid large gatherings, keep physical space between yourself and others that are outside of your household. And when you can't do that, to wear a face covering. As you heard from our hospitals today, the number of individuals that are hospitalized with COVID has dropped significantly from where we are back in November and early December. And our hospitals are in a much better place right now to be able to maintain capacity and serve everyone that needs to receive hospital care. I want to say thank you to everyone who has taken this situation seriously from day one and who continues to take it seriously, and has done those things that we can to slow the spread of COVID-19. And along with that, I thank each and every one of you, our board members, for taking the actions that you have during the last year to help us and our hospitals and our communities get us through to the point where we find ourselves now. We already talked about that in December, January, February, we did experience very positive downward trends in hospitalizations, cases, and deaths. And as we've mentioned already, unfortunately, we're seeing that trend turn around a little bit with an uptake in cases and hospitalizations in our district. We know that it's not contributed to one specific factor. There's many things that play into that. A couple that come to mind is that on February 2nd, Governor Little did change the statewide restrictions. We moved from stage 2 to stage 3, which allowed ease restrictions on gatherings that had been in place statewide. Around that same time, schools were allowed to increase spectators in their gyms for sports, allowing 40% capacity. And as I have just seen the news and highlights of sports activities, it's apparent that not everyone is continuing to heed the recommendations of physical distancing and wearing face coverings when they're gathering together with others. And then we did lift the public health orders that were in place for 3 of our counties, specifically Bonneville, Jefferson, and Fremont. And add that to the mix that people, as James reported, are not staying home when they're sick. You mix all those things together, and you can see why we are seeing an increase in cases. We knew that we were never going to be able to eliminate the virus completely, and we know that we'll continue to see cases. But as we heard from our hospitals, they are in a much better position with staffing and other resources, as well as treatments to care for people that are infected with COVID. But they are in a good position to care for all patients that are needing hospital care. Our kids are in school, our businesses are open, and more people every single week are getting vaccinated. With all this being said, I feel that continuing to issue public health orders is no longer justified, and that's why I'm proposing some changes to our original response plan. But does that mean we should all stop taking precautions just because any public health order that may have been in place is no longer in place? And the answer is absolutely not. We know that the mitigation strategies that we've been following for the last year work. And it's just as critical now as ever that we continue these until we are able to vaccinate a higher portion of our population. We can all choose to do those things that we know can slow the spread of the virus. Can we make everyone do these things? The answer again is absolutely not. You've heard multiple times, even just in today's meeting, that we know that people don't follow the orders when they're in place. Including individuals, businesses, and even schools. But again, I make a plea for personal accountability for everyone to make the choice for yourself to help in slowing the spread of the disease, whether or not there's a public health order in place until the time that we can have enough of our population vaccinated to get protection against the virus. I'd also say that it's hard to know if public health orders change people's behavior or made a difference. I know I can say that I've heard personally from people that say because a public health order was in place, it made them do those things where they otherwise may have not done them. But the fact is, we've seen case rates rise and fall in counties that have public health orders in place, as well as counties that don't have a public health order in place, not just in our district, but across the state. What I can say is when people saw the critical position that our hospitals were in back in November and December, behaviors changed. And for that, I do sincerely thank everyone again for the efforts that were made to be able to allow our hospitals to do everything possible to maintain the level of care that's come to be expected by every single one of us. So with those comments, I would like to bring up the plan and talk through some of the changes that I am proposing. And I guess before we do that, I'm happy to answer any questions.
Any questions? We'll go ahead and go on to your plan then, Jerry.
All right. In this draft that is also available on our website for public viewing under the meeting materials, I have redlined several sections of the plan. And it all has to do with the issuance of public health orders. You can see in this first section, I have redlined the statement about that a board member in consultation with commissioners from that county can request an order stay in place, simply because if I'm proposing that we eliminate issuing public health orders from here on out as a routine matter of business. I did take out some other things that we had early on to be able to help us monitor the level of disease circulating in our communities. Nothing at all changed on page 2. It does simply more education about confirmed and probable cases and where we finally settled on the various metrics for the risk levels for situational awareness. Page 3 is where you're going to see the majority of the revisions. I did include in here that one of the things that the preventive measures that people can do is to seek a COVID-19 vaccine when it becomes available to them. Some changes were made in this bullet based on changing recommendations from the CDC for isolation and quarantine for people exposed to COVID-19. Some of this stuff, the first 4 bullets were simply duplication. I kind of rearranged the page some, a duplication of the preventive measures that we have just up above. But right here, this section is where I have stricken the language having to do with public health orders. However, I would like to have remaining in this plan that at any time the situation changes significantly, that does require some significant action by our Board of Health, that is at the board's discretion. Mr. Chairman, that is the summary of the changes being proposed.
Well, let me first say, and then we're going to need some discussion from board members, obviously, but let me first say how much I appreciate all the work that you and James have put into this plan. We had the first and only plan back in July because of your desire to and your sense of responsibility to do what we can and what you can to help guide our board. And we have followed your guidance through this, and you've been willing, as the situations on the ground has changed, you've been willing to recommend adjustments to make sure that we are up to date and using the most current science, the most current knowledge, follow the most current, medical treatments that are available in the hospitals. And so we followed you and made those adjustments, and it's always ended up being the right thing to do. You pointed out three things that I wanted to touch on when you were talking, and I appreciate your really honest, sincere assessment of the last year. But you mentioned that the entire purpose of the work that we've done, including the plan and the health orders that have been issued, was to protect hospital capacity, so that any emergency that came up, whether it be a car accident or a heart issue or a COVID patient that needed hospitalized, that there was a bed available for them. It just makes me happy to report that was accomplished in our health district. Our hospitals, although they were very stretched during that peak time, they always had a bed available within all of our hospitals put together. I know Lemhi County had to go on divert for a while, but other than that, the hospitals here in Bonneville County, in Madison, there was always a bed available. And that wasn't the same across the state. In fact, our two neighboring health districts, we had 20 patients in our hospitals at the peak from those hospitals in those health districts because they were on divert, because they were not handling it. And I give credit to the hospitals for stepping up and all the hiring they did to help with their staffing, sourcing supplies, the ventilators. They worked so incredibly hard. And so I credit them for that. I credit the doctors, the nurses, the EMTs, everyone working in that hospital system. And I credit our public, those members of the public that were willing to be, to help with a solution for the problem, to help to be part of the solution. And so, yeah, I'm grateful to all of them, but those hospitals did remain that way. You also mentioned that the other reasons that you had the plan was to keep businesses open and schools open. And in our health district, we have never closed any business, never recommended closure of any business, and nor any school. And so when you mentioned those three things, I just couldn't help but be glad for what you have done this year, and that those things were able to be accomplished. With that said, I fully support where you're going now with this large amount of vaccine that is out, particularly over 50% of the 65 and older group that have been vaccinated. All the medical professionals, first responders, teachers that wanted the vaccine have been able to get it, and we're vaccinating a large number every week. We have a lot of immunity now. Another reason I feel good about it is the plan that you're still going to have in place still asks for all of those mitigation requirements. In fact, in the plan, it asks businesses to continue to require face coverings in their business. And just by sense that you are recommending it for everyone, it comes with a strong recommendations for schools and everyone to continue it. I just feel strongly that to issue a public health order to an entire county, each and every citizen in the county, that takes a somewhat of a critical need to justify that course of action from a public agency. And that need was there. I firmly believe in my heart that we had that need late last summer and throughout the fall. for the reasons that you mentioned. Most critically is to keep those hospitals able to treat all patients. And so I feel good about that. But at this time, I do not sense that there is that critical need that would justify that. Now, for a city to issue it or schools to take direction within their schools, that's different. But to issue an order for an entire county by public agency, there has to be a strong need, which we had at one time, but that is not there now. So I support the direction that you are recommending today. And I would like discussion from board members, because this would be a significant step, change in our plan.
Mr. Chair, Bill Lake.
Go ahead, Bill.
I totally agree with everything that you said and fully support that entire logic as it goes towards the issuing of orders. I think the issue we're facing in Teton County is how do you get out of an existing order? So rescinding an order and doing that in some kind of logical, methodical manner so that people can be educated to do that. So I just wanted to be clear that Teton County's I'm not arguing that we continue to have something in place where we can issue orders. So just want to make that clarification. And by the way, I also want to commend Jerry and her team and my fellow board members over the last year of what we've been through. It's been an education, and I'm very proud to have been being part of that to get us to where we are today. So thanks, everybody.
Thank you, Bill. Are there other comments from the board?
This is Commissioner Young. Go ahead, Doctor.
Yeah, this is Dr. Nelson.
Go ahead, Dr. Nelson.
I think rescinding a mask mandate is being done prematurely. We saw a rise in cases once we lifted our mask mandate. We don't have a significant enough number of the population vaccinated. And we're seeing some variations that, especially like the South African variation, has a higher propensity for reinfection. So counting past cases in there kind of complicates things. We're talking human lives here and disability. And I think we've seen that compliance is worse without a mandate. So I'm opposed to changing that plan.
Okay, thank you, Dr. Nelson. Are there other comments?
This Commissioner Young, I just wanted to be clear. So if we did update the plan, this would essentially rescind all mandates from the health district. Is that correct, Jerry?
So, Mr. Chairman, that's part of the discussion that needs to occur, and as well as a transition timeline. Again, as Bill has mentioned, would it be responsible that we immediately rescind mandates today? Probably not. But if the board chooses to go this direction, to identify what that transition period looks like.
Yeah, I don't think any action we would take on the recommendation to change the plan, that action alone would not rescind the order. So we would still need to take action and have discussion if it's appropriate to do that at this time. So this would only be about the recommendation of the plan. Are there other comments?
Mr. Chair, Bill Lake again.
Go ahead, Bill.
Considering Dr. Nelson's comments and looking through the revised plan presented by Jerry, is there anything in there that precludes us from, let's say, next week or 2 weeks or 3 weeks or a month from now to coming back and issuing an order if the need was there?
Mr. Chairman,
go ahead, Jerry.
I was just going to say I've highlighted the section on the plan that I believe gives the board the ability to do as you see fit based on changing circumstances.
And again, I think we need to go back to that hospital number, because that was what our entire plan was based on, is if there is a threat to capacity in the hospital. And obviously I understand that you have to be in front of that. You can't wait until the critical need is there and then make a change. So you have to be cautious to be in front of that. And so I guess I would, in my mind, how much faith are we putting in the vaccine? With the amount of vaccine that we have out there now, if it is going to work, which of course I believe that it is, I know that it is, that should give those hospitals protection. But are there other comments from board members? Commissioner Mendenhall?
Well, my finger was hovering over the mute button. I am taking into consideration what Dr. Nelson has said and other comments, and then of course the general public, and we've used the phrase "follow the science," and we've relied on medical knowledge, and I'm beginning to wonder, when do we plane out? When do we level out? When do we lose what we're trying to accomplish? If we turn to, as an example, Victor and Driggs, who have had face covering mandates in place, and yet they had a roller coaster ride. I am convinced that face coverings do work. I am convinced that education works. I am hanging on by a thread for that exit strategy of when do we say, okay, people, we have educated you now for 12 months, take a little responsibility. And I'm not sure that and yes, we will take some criticism from the public. We will take criticism from even the press, perhaps. We'll take praise from the public. We'll take praise from the press. This isn't a popularity contest. It is one that says, okay, what are we doing that makes sense in our lives? Have we leveled out? And I don't know the new strains that are coming. Dr. Nelson would know much better than I what to expect from those and how perhaps more potent they are. But I like where the plan goes. I do. In the red banner at the very top of the plan, the health district, when we devised this plan, that red flyer, this plan is a fluid document, subject to change as more information becomes available. And more information is available. And yet Jerry has left, and I like this, has left down there on page 3, I believe it is, at the very bottom. If the COVID-19 pandemic reaches a critical level, so forth, and you can read that. We need to manage a very, very, very difficult situation. And that management does not come from yo-yos, rescinding and putting in place health orders. We lost our identity of health orders versus a mask mandate. And they lost sight of wash your hands. We went from staying 6 feet apart or wearing a face covering to stay 6 feet apart and wear a face covering. And this thing has just evolved. And I believe we have a fluid document, and I do support this with the cautions that Dr. Nelson has put in place. Yeah, we're going to face this. If it goes back up, we're going to exercise that paragraph that Jerry put in there, that the staff put in there. So I just have to say I support it. We have to figure out a way to manage this and get the public support to have them take some responsibility. So, end of comments.
Are there any other comments?
Mr. Chair, Bill Lake.
Go ahead, Bill.
Having all this conversation, what I would recommend or suggest maybe is we just simply add a statement in there that says, in consideration of the existing orders in place as of March 3rd, being Teton and Madison County, that those orders will be rescinded effective March the 18th. That gives us 2 weeks to transition out of them.
Okay, I appreciate that recommendation.
Mr. Chairman, along with what Mr. Lake has said, does that transition include, and this could put pressures on the district staff, as much of an education campaign as we did going into this? Will it require as much, if we take 2 weeks, what kind of education plan can we put out in 2 weeks that says, hey, yes, we're rescinding these health orders, but listen, the medical world is still saying you've got to wash your hands. You've got to wear a face covering if you're in groups of close confinement. And perhaps Jerry can help us out with that way. What is there an education strategy that we need over the next 2 weeks? And Madison and Teton are at the forefront where we rescind those health orders. But the rest of the counties are in just as much peril if they don't continue to follow the recommendations of the health district. So it's just a question to pose. What happens in the next 2 weeks? And don't need to get into the weeds, but is it going to require an educational process and public announcements and a letter to the elected officials and so forth and so forth?
Mr. Chairman, I can say that we have continued to educate every single day. We do a daily report on Facebook, and a piece of education goes with that every single day. I would say that people have become tone deaf to the information that we're sharing. They want to get back to normal. And I would maybe even look to Bill, because Teton County, very much to their credit, they have implemented their own education campaign that continues, weekly, that public messaging. We can up that. We can do a letter to elected officials. We can, do different messaging to the public, and continue those efforts. But I guess, again, my plea is that people understand that we're not at the end of this pandemic yet. And Dr. Nelson is right. There are variants that we don't know how they're going to impact what we're seeing here in Idaho. We don't have everyone vaccinated yet. And by summertime, we'll have everyone that wants to be vaccinated will be. It still goes to the efficacy of the vaccine and what that does. And as we mentioned earlier, a lot of that is yet to be seen. So the answer is yes, we can do all those things that you mentioned, but it comes down ultimately to personal responsibility and personal choices.
So let's take this piece at a time, because we do have the issue of our health orders that are in place. And what Jerry has recommended with the plan does not change that. So if this is the direction that we're going to go, if we're going to follow the recommendation of Director Radkow, I would need a motion to make the amendments to the plan.
As Chairman Reed, I'd like to make a motion that we adopt the plan as what our Administrator Jerry has outlined, that we adopt the plan as proposed.
Yeah, I'll second it.
There's a motion. I've got a second by Commissioner Shenton. Discussion on the motion.
Bill Lake, please.
Go ahead, Bill.
As long as we all understand and that we still have the discussion on Madison and Teton County as to the effective date of rescinding those orders, I can support the plan.
Yeah, and that discussion will follow. And that action would still be needed to change anything there. Is there any other discussion on the motion from Commissioner Young? Hearing none, we'll do a roll call vote. I'll start with Teton County, Mr. Lake.
I vote aye.
Jefferson County,
Shane Young votes aye.
Madison County, Commissioner Mendenhall, Madison County,
Here, let me take that off of mute. Commissioner Mendenhall votes aye.
Fremont County,
Commissioner Dance votes aye.
and Clark County,
Commissioner Shenton votes aye.
Lemhi County,
Commissioner Mattson votes aye.
Custer County,
Commissioner Butts votes aye.
and our physician, Dr. Nelson.
Dr. Nelson, I vote no.
All right, the motion passes with one dissenting vote from Dr. Nelson. So Jerry, we'll go ahead and ask you to make those revisions to the plan, and I'm sure you'll get them posted with the clean copy on our website as soon as possible.
And Mr. Chairman, I'm thinking as, as we've been talking here and what additional education, I think back to March of last year. In fact, I think it was March 23rd as I was pulling our website. In February, we did a public notice, and then March again, another public health notice that this is serious. As I make the approved revisions to the plan and post that, I think I would like to also include a public health notice or advisory that goes along with that, emphasizing that we want people to follow all these same recommendations from national, world, national, and local public health experts and medical providers, that we still need to take all these precautions until we're at the end of this pandemic. So I will make those changes. I will draft that advisory and get that posted. With that being said, I want to say a couple more things that, school districts right now, it's at the discretion of the school boards of the precautions that they adopt for their school districts. And I applaud those school districts that have continued to follow the CDC recommendations to make the decisions that do protect the staff and the students and the teachers. Businesses, those that have continued to require face coverings in their businesses, I would encourage that to continue. That gives your customers confidence that they can safely patronize your business without fear of coming into contact with the virus. And then on the individual level, again, make the decisions that you can for your health and for the health of our community. And as an individual, you do have the choice to not go to places that are not taking precautions. And we see that all the time, that not everyone is following the recommendations or even the public health orders that are in place. And individuals can make those choices to visit those places that are taking precautions. If they're vulnerable, in a vulnerable position, that's the prudent thing to do to protect yourself. And we would encourage everyone to continue making the choices for yourself that protect yourself.
I appreciate what you've said, and I couldn't agree more that we hope that the public will all continue to follow. It is absolutely clear the face coverings, the social distancing, all the mitigation factors that have been used have helped reduce the spread of virus. It's clear because of what you can see has happened with influenza this winter and other respiratory illnesses. I mean, that is the most clear and compelling evidence that all of these factors work. That's clear. And so we hope that everybody will continue to do those things. And that the vaccine continues to go out until we do have full immunity, because it's certainly obvious now that what happens in one community affects another. And so it really does take the entire community working hard to help support each other to get the virus load low enough so that those who aren't protected are not in threat. So we'll go ahead and move to the next item on our agenda, which is item 6, which I do not believe there is any longer a need for that agenda item. So we'll go ahead and move back to item number 7, which had been shuffled, but we'll go back to that because we do still have health orders in 2 counties. Mr. Lake has spoken compellingly to allow somewhat of a transition period in Teton County, although they have been under the metric for quite some time, with the exception of the last 2 days. But the last 2 days have been concerning for him, and I understand. So other comments. We've got Madison County and Teton County in this. Commissioner Mendenhall, what would be your desires in Madison County?
In Madison County, I'd like to have it come into line with the revised plan that we have. The effective date, I'm unsure of that. I appreciate what Bill is doing to allow that time period for people to get a hold of this, that it's not ollie oxen free, that we just go do what we want to do, but rather that we're still under a be cautious. But I would propose even March 8th, which would be a week and a couple of days. I don't know the time frame. I just don't. I don't know if 2 weeks would be enough. I don't think more than 2 weeks is necessary. I do not know. I have to lean to Jerry and to James. At what point people are saturated. Jerry made that comment, and I wholeheartedly agree with that. There's going to be those that are going to be wise, and there's going to be those that are going to be foolish. And I'll let the public decide who's which.
So Jerry or James, would you give us some guidance and Dr. Nelson on what would be the most prudent way to rescind these orders, particularly in Madison County where they've continued to stay above the metric?
I'll start, and I think it would be good for consistency that we do the same thing in both counties that are in that have orders in place. And so I would feel comfortable with what Bill proposed, going to March 18th, which is 2 weeks from today. Over the next 2 weeks, certainly do that outreach, letting people know of the changes, and really emphasizing the need to continue with the mitigation measures for the months ahead until we reach a higher level of vaccination.
James, do you have any comment?
No, like Jerry, I would say that it would be best to probably have the same date for clarity's sake if we're moving to that. I believe, just looking at the data, that 2 weeks would be closer to getting Teton County back under. I believe they will go over 15 again today, but with 2 weeks time, you'd be at least adhering to kind of the previous plan's intent of 14 days. And as if cases continue to go down, which we're hopeful for in Teton County, I believe that would put about that timeline as well. So
another good thing with that date, I guess, would be that you will be through that 65 and older population that have all desired the vaccine. We would be through with that subgroup at that time.
And just one caveat with that is that we'll be through with at least one dose for everyone.
Right. Dr. Nelson, comments?
Nope, no comments.
So that comes back to a question that I've had, and for James or anybody, Amy or Jerry, how much protection do you get with one dose of the Moderna and Pfizer? Is there any clear science on that yet?
This is Amy, and I would say no. Those are the studies they're looking at right now, and you're seeing other countries, delay the second dose to get more first doses out there. There's some protection, but no, I don't have an exact answer on that yet. I mean, we know all those clinical trials were done on the 2-dose, and they know what that is, 4 weeks after that, 2 to 4 weeks after that second dose, or 2 to 4 weeks after the first dose of Janssen.
Dr. Nelson, you cited a study, so I know you're constantly researching and reading. What is the difference between the Janus is just one shot and the other two that require the two? Why is the Johnson & Johnson only a single dose?
It's got a little bit different design than the mRNA vaccines. It's actually on an adenovirus platform. And I don't know why they designed the study for one-shot efficacy, but this is kind of based on older styles of vaccines.
Okay, thank you. It's been something I've been wondering.
And just to add to that a little bit, I know Janssen's they're in a study right now with a 2-dose, different formula with it, but a 2-dose vaccination schedule.
Okay. So is there other discussion? If not, we would need, if you want to put a fixed date on rescinding those 2 orders, we would need a motion to do that, which we could take care of now. Our next meeting is not scheduled until April 1st.
Mr. Chairman, I can make that motion that we rescind the health orders in Teton and Madison County effective, I'm sorry on the date, effective March 18th.
This is Bill Lake. I second that motion.
Okay, there is a motion and a second. We'll go ahead and go through the roll call on that again. So we'll start in Teton County.
Aye. Bill Lake.
So I'm sorry, but I do not want to stop any, and I'm sorry to interrupt the vote, but I did not ask for any discussion on the motion. Is there any discussion before I call for the roll call? Okay, hearing none, we'll go ahead and proceed with the roll call. We've had Mr. Lake at aye. We'll go to Madison County.
Commissioner Mendenhall, aye.
Fremont County.
Commissioner Dance, aye.
Jefferson County.
Commissioner Young, aye.
And Clark County.
Commissioner Shenton, aye.
Lemhi County.
Commissioner Mattson, aye.
Custer County.
Commissioner Butts, aye.
Dr. Nelson.
No.
Okay, the motion does pass, again with one dissenting vote. And so we'll go ahead. I'll leave that to you, Director Radkow, how you message that. Maybe there doesn't need to be any messaging. I don't know, but I'll leave that to you, the best way for those counties to understand where they're at, and so they can start making changes that they feel like are needed.
Before we move off this topic, sorry, Mr. Chairman, I just again want to say, and James put it nice earlier, that there was maybe some premature celebration of the positive trends that we were seeing. It's not time. It is not time to ease up on your decision to follow the mitigation measures. We ask everyone to continue doing those things that we know can slow the spread of the virus until such time that we have a much higher level of immunity in our population.
Thank you.
Mr. Chair, comment?
Yes, go ahead.
I would like to say that if there's any members of the media or press out there that before they tomorrow put in the newspaper or start advertising on the news, our decisions of today, that they really should talk to somebody, Jerry or somebody in her organization, about the messaging and how it should be presented, so there's no confusion on the public as to how we're moving forward. Thank you.
Okay, thank you. Okay, we'll go ahead and move on through our agenda then. I know it's been quite a lengthy meeting. I appreciate all the time of everybody. We had a lot on our plate this morning. We'll go ahead and move to number 8, which is a legislative update. And Bill, I'll ask you to lead out that discussion. Go ahead and explain why the public, what committee you are on. I know you've been highly involved in legislative issues lately. I see you're still, there you go.
Thank you, Chairman Reed. Yes, as I'm the appointed board member to the Idaho Association of District Boards of Health, and in that capacity, I act as the trustee and the member of the executive council for all the district boards of health across the state, all 7 districts. As the trustee, my role was basically to support a formula that the state uses to disperse money given by the state to the health districts to the tune of, I think it was about $10 million a year. But my other role, the one I'm going to speak of today, as a member of the executive council, we have been meeting weekly on Fridays at 10 o'clock to discuss upcoming legislation that would be affecting the health districts. And one of the things that I have to let everybody know is that we've been in executive session on most of those meetings recently, because we are not allowed to talk about proposed legislation that's being drafted, except when we're in executive session, and anything we discuss in executive session, I can't share with you today. With that said, I think the most recent bill that's come out that we can talk about is that in the future, any countywide orders issued by the public health districts is going to be required to have approval by the Board of County Commissioners for that respective county. And along with that bill that's out there right now being pushed through or going through the legislative process, it also will change any penalty on that from a misdemeanor to an infraction, which makes it much easier to enforce than when it was a misdemeanor. You know, even though all the boards of public health are made up of appointed or existing elected officials, or somebody appointed by an elected official from that county, the legislature felt it was very important for local control, local government to do that. And to be honest with you, there wasn't any real issue with any of the district boards across the state, that we thought that was actually probably a good thing. So along with that, and then I'm gonna get Jerry to help weigh in here. There's lots of legislation going out there. The one that I'm most familiar with right now is I heard that a representative is proposing a bill that would prevent the mandate of wearing masks or gathering sizes to be issued by the public health districts or Department of Health and Welfare for that matter. I think it can only come from a governor. So there's many other bills going on out there that are going to affect public health districts. And Jerry, I don't know, could you bring up that list that Kelly provided us from IAC?
Yeah, give me just a minute.
Okay. I would bring it up myself, but I don't have that capability, I don't think, through Zoom.
It's going to take me just a minute to get my email open.
Okay. The Idaho Association of Counties, the representative provides us a week, every week or two, an update of all the pending legislation. And it's a very good summary. So I think I'd rely on that to, when Jerry finds it, to share with everybody.
Almost there.
While she's doing that, along with Medicaid expansion, you know, the cost of Medicaid expansion is more than what was predicted. And I can talk about this, though I don't think there's any specific legislation out there yet, that, you know, they're going to be looking at counties and other places across the state to work to come up with that additional funding. So that may be something that comes up on our radar sooner than later. Okay, it looks like Jerry's got it. And Jerry, since you've got it in front of you, if you want to just scroll down, and when you see one that we want to talk about, we can stop there and.
Yeah. I'll stop here first on Senate Bill 1139. This is one that is doing some cleanup of language. And just for people that Idaho's had a different definition of isolation and quarantine than the rest of the nation. And so it's more bringing that into alignment with the standard definitions of isolation and quarantine. Isolation would refer to the separation of a sick or exposed individual, and quarantine would be that of a physical building. This one also does talk about the power of the Director of Health and Welfare to issue public health orders. I will just mention the abortion one. Public health is not involved in any way with abortions, but public health is called out in this specific bill as being one of the units of government that would be prevented from using any public asset towards abortion. It's Senate Bill 1060 that Bill was speaking to about the Board of County Commissions having to approve a public health order that was implemented countywide. And then House Bill 67 and 68, both do call out public health as well, that we do not have the ability to close down a school for contagious or infectious diseases. Those are the primary ones right now. In addition to the one that Bill mentioned with the prohibition on mask mandates, that did just get a print hearing earlier this week. I've not seen it come up for a full hearing yet.
And with that, Jerry, I would like to thank Commissioner Reed and Jerry, who have been heavily involved in a lot of these discussions and with what's going on in the legislature. So while Jerry's been doing everything we talked about today, she's also been working through these other activities. So appreciate that very much. Thank you.
Thank you, Bill. Thanks for that report, for all the extra time you put in on that legislative committee and as a trustee for our district. We'll go ahead and move then to item 9, which is ratification of subgrants. We haven't done this in a while, Jerry.
Right. I'm getting it pulled up on the screen here. Just a moment. Are you able to see my screen now?
Yes.
As Mr. Chairman noted, we have not done a ratification of subgrants for some time. The process that is in place with our health district under the direction of our board is that as a new subgrant comes into us, I do have the ability to review it. If it's a new one and I have opportunity to present it to the board prior to the deadline for signing it, I certainly do that. Otherwise, I've been given permission to enter into the subgrant and bring it back to the board for ratification. Typically, we just do this in a consent agenda, but I thought since we'd not done it for a while and we do have some new board members, it would probably be good to just talk about it in a little more depth today. I don't want to take a lot of time on it because we have gone past what I had anticipated this morning, but I just want to read down each of the different subgrants, and you can see that the 99% of these are through the Department of Health and Welfare, generally federal funding that goes to the state through the Department of Health and Welfare, and then they subgrant with the local public health districts to actually deliver the service at the local level. I'm going to turn to each of the division administrators to just give a very quick synopsis of what each of the subgrants are. And we'll start first with the Children's Special Health Program.
So the Children's Special Health Program covers travel costs for specialty physicians and healthcare personnel to come in from out of our state or area into our health district to provide services for children's left palate, those type of services, cardiac.
I'm going to just stay in order with Amy and let her talk about all of her subgrants. The next two are Title V and Title X family planning.
So those provide reproductive health services for women in need, breast and cervical cancer screening. And then I'll go down to the HIV care and HOPWA, provide case management and services for individuals living with HIV. Also, the little one in the middle there, the HIV and AIDS surveillance is, covers when somebody's diagnosed positive and then surveillance around that positive case. I'll jump.
We skipped
down.
the COVID vaccine preparedness.
The COVID vaccine preparedness. So that was some initial funding just to support the vaccination efforts of COVID vaccine. Initially, we're expecting maybe some more from that later on and maybe some clearer definition of what those funds can be used for specifically. Jump down to the Immunization Cooperative Agreement. That is for immunization awareness and efforts for routine childhood vaccines, not COVID vaccines, for children 0 to 18.
And then we had this.
And that. Oh, and there was, you're right, I'm sorry, the extra one, there was a little bit of extra funding around to provide influenza vaccine early with COVID, but also not wanting to see both those viruses out there. And so there was some funding to provide flu vaccine to adults. And then part of that same one, we also work with private providers in our area that provide vaccines for kids 0 to 18, just to do some quality assurance with them, vaccine temperatures, make sure they're following the schedule accurately.
Let's go to Angie with WIC.
WIC, it allows us to provide WIC services for women, infants, and children within our health district.
PKU.
And the PKU program allows us to serve patients living with PKU, which is phenylketonuria. We are able to provide a dietitian to provide nutrition counseling for them, monitor blood work, and then we also support a physician that comes in twice a year from Oregon, a specialist, to provide clinics for those patients.
I'll speak briefly on the suicide prevention. That is a subgrant that we have to work with our local coalitions and other people involved in suicide prevention work throughout our health district. A major focus of it this last year was to develop a gaps and needs assessment that has been provided to the state, and then we'll be doing some other targeted efforts based off of the information from that gaps and needs assessment. Then we'll go back to James.
So tuberculosis control, this helps with efforts to help with both active TB or latent TB activities to help control potentially infectious diseases, including specifically to this one, tuberculosis. Going up the page, our public health preparedness, emergency preparedness program has been at the limelight this last year, but again, this is an annual renewal of that. We work with different community partners to make sure that public health emergencies can be planned and help to recover from. Oral health program, this is a small amendment to that overall sub-grant to add just a slight activity for some training that they had to accomplish. The NET system, or the National Electronic Disease Surveillance System, that's where all of those case rates that you see posted on the state website, and then other information that they're able to get from that up to the CDC level, we're required to put that information into that electronic disease surveillance system, and they give us a little bit of money to accomplish that work. The maternal infant early childhood home visiting, or parents as teachers program, is, you may have heard a call from us, is an annual renewal. We were able to get that done. This next one will be for 11 months through next January. The hospital preparedness program, we did sign that last year. That corresponds or is in conjunction with the public health emergency preparedness. Our hospital preparedness program helps to do a healthcare coalition in our area, as well as help with hospitals becoming prepared for different surge potential activities. This year they've been working on actually pediatric, potential pediatric surges. Let's see. The drug overdose prevention program, you heard from Mallory this morning. She's doing great work inside that. It helps to look at overdose and education along those lines. Our diabetes, heart disease, and stroke prevention, we added some funding specifically for a special project with dental offices potentially to help with A1C, and that's to measure your potential for diabetes, and then to get referrals done to primary care providers with that program, as well as just continuing the work of the heart disease and stroke prevention and education there. The school response, we'll touch briefly on. That was one that came in October and November. The state wanted to be able to help with funding to have staff here at the public health office to help schools with any necessity they might need. You can see that it was originally scheduled to go through the end of June. They've since backed that off. What we found was we probably needed that right before October. Most of that work went to either Jerry or I as we started the school year. So they have been helpful. I have had a staff here doing that work with a lot of the schools and doing some education on contact tracing or being their point of contact. But that has run its course, and we believe that they're in a good position after we've done that education.
Are there any questions on the sub-grants? And Mr. Chairman, I noticed that I neglected to put that as an action item, but I would ask for a motion to ratify these renewals.
All right, well, it is on the agenda, listed as a ratification. So I would need a motion to ratify these sub-grants.
This is Commissioner Dance. I would make a motion to ratify the actions taken under sub-grant summaries.
Thank
Bill
you.
Lake, I second.
Second by Mr. Lake. Thank you. Any discussion? All in favor, say aye.
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 All right, thank you. Anyone opposed? You have a complicated job there, Director Rakow. You oversee a very large organization with a lot of moving pieces. So we are grateful for your talents and all the work you do. And we're certainly grateful for the talented staff that you have around you.
So am I.
And what they all do. So we'll go ahead and move on to the next and final, very important piece of our agenda. Another talented staff member that we have there, our Chief Financial Officer, Mr. Stephen Thomas. And this is important, especially as counties now begin the preliminary work of budget season. Each of our counties is coming up as well for Eastern Iowa Public Health. So go ahead, Stephen.
Okay, thank you. I think you guys, Jerry already has this up on the screen.
Yes.
Okay, we've got reports through the end of January. As noted, we are below our current approved budget on expenditures, and we are just barely above, compared to some years, our revenue budget. Part of that is we have spent a lot on this emergency response based on CARE Act funds that were promised, and those have been very slow coming in. I noted there that we finally did get a large amount in February, which isn't showing in this report, but $380,000 plus, and there's still over 200 left outstanding for CARE Act reimbursements. Any questions on the CARE Act part?
Any questions, board members?
This is Commissioner Dance. Do we need to, on that slide that Jerry showed to us, do we need to amend or adjust those dates in the general notes section to 2021?
Oh, yes. Those are all 2021.
Thank you.
Thank you, Commissioner. Good pickup.
Used to be Dave Radford that caught me on that every time. Glad we have somebody else. One thing that we did do to change our budget, that I just wanted to kind of highlight, back in October, we did open the budget and increase. And if you look at the expense summary page, you can see on the emergency response budget, we added $1,600,000 plus expenditure amount. We're actually spending that even faster than originally anticipated. When we first done that board motion back in October, we thought, well, maybe we won't actually spend all of that. But if you'll note, as we go month by month, in January, we're up over 200,000. And it looks like the $1.6 million may not even be enough before we get to the end of the year. Just to make the board aware that as we're expanding into the vaccine part of the process and still doing contact tracing, there's significant costs being incurred. And we may have to adjust the budget again in the future.
Mr. Chairman, this is Jerry. May I just chime in there for a moment? As we talked at our last board meeting, specifically on the immunization side of COVID, that we are billing the administration fee in addition to the small subgrant that we received already from Health and Welfare and more that's anticipated, as well as we're able to participate in the grant that has been provided by the state for vaccine administration. And so we still feel that we will cover the cost of the immunization piece with all those funds. But again, I think we will be coming back to you in April with likely some budget adjustments.
Yeah, agreed with Jerry. It looks like the funding is totally available to accomplish these tasks. It's just taking some time between when we have to spend and when the funding arrives. One thing that Kelly had mentioned that I just wanted to highlight on the revenue, environmental for septic revenue, and that's without a change in the septic fees. The year-to-date in 2020 was 383,000 versus 2021 we're at 420,000. So the septic activity continues to rise. That is a continuously growing activity, it appears. In spite of COVID's economic impacts, Eastern Idaho is still installing lots of septic systems. And as she mentioned on her audit issues, the earlier approval of some extended staff, she's just going to need to keep watching that, because generally when the revenue is going up, that means it's taking more time and work to accomplish what we're doing.
Are there any questions from the board? All right, thank you. Is there anything else?
Not for me.
All right, very good. Thank you. Anything else, Jerry, in conclusion?
No, Mr. Chairman, that is all for today. I would just say that we have our next board meeting scheduled April 1st. And then April 29th would be our next one. And that's when we will have our budget presentation for the board for fiscal year 22.
I think those calendar invites have already been sent out to board members, so you should have them on your calendars. So I just want to thank each of you for your continuous work throughout this year. It's certainly taken considerably more time than is typical on a public health board. But I appreciate all the work that you've done and just a sincere desire to make the right choices at the right times for each and every one of you. And so with that, we'll